Okay, now we are going to learn about the pharyngeal and the palatal reflex. So, palatal and the pharyngeal reflex. So, when you consider palatal and pharyngeal reflex, always consider it to be done last. Although we have this order, if you are ever doing this, just do it last, because the actual reflex is when you touch the inside soft palate, the palate will start arching, like as if some food is coming and it will close the nasopharynx like that. So that is the actual reflex of the palate. And the pharyngeal reflex is if something touches the posterior pharyngeal wall, it will produce a gag. Gag reflex means you will feel like vomiting up. It is obvious when you eat a lot of food, put stuff all a lot of food in the mouth, it can hit the posterior pharyngeal wall and you will feel like vomiting. So essentially it is all these reflexes that come through. So how to test it is using a cotton swab. Cotton swab, oh yeah, cotton swab. Make sure that this cotton swab is also very clean, because you are putting in the mouth, and don't expect that I am going to put this in the mouth, because the reflex is gag. So in normal patients, if the patient is well off, we usually don't do it, although it is good to know in people with stroke and some other CNS problems, where there is some problem in the nerve roots of the vagus and the glossopharyngeal. The sensations won't reach the center, so they won't have this gag. So this is what we are testing, and they won't have the gag and they won't have this palatal arching thing also. This is about the pharyngeal and the palatal reflex. So there is a chance for you to think that the pharyngeal and the palatal reflex are useless, because the pharynx just arches and the posterior pharynx produces a vomiting sensation. So it is not like that. The idea is that it's a part of the deglutition. When you touch the pharynx, it starts the deglutition reflex, and so it closes the nasopharynx. And if that doesn't happen, when we swallow, the food will come through the nose. So that is what we talked in that class about nasal twang of voice, nasal regurgitation, because the palate doesn't close the nasopharynx. Like if this is the posterior nasopharynx, if this is the posterior pharyngeal wall, the palate will rise up and it will close. The soft palate will close, so that no food comes through the nose, if this is the nose. So the palate will close this. If this doesn't happen, what will happen? The fluid will pass through it and come out. So that will produce nasal twang of voice, nasal regurgitation, and so on and so forth. So that is how you do that. Now about the test. How you do the test is take a cotton swab. I'm just explaining, we are not going to do it. Okay, take the cotton swab, ask the person to open the mouth and slightly touch the both sides of the soft palate. Okay, and you can see the soft palate producing an arch. Okay, so that is the palatal reflex. The pharyngeal reflex, to get that, you take this cotton wisp and go deep and touch the posterior pharyngeal wall. If you touch the posterior pharyngeal wall, what will happen? There will be a gag. So that is what we test. Test it only in very few subjects, because it is very uncomfortable. And if ever you have to do it and you have a doubt whether you will get it or not, do it last, because after this test you might not get the support of the patient.